Hey guys, Dr. McKinney. I'm with Genevieve. And Genevieve, when did you start our neuropathy program?
June 16th.
June 16th.
Yeah.
And since June 16th, how have you been? Because we're now, what is the date? September the 19th?
The 19th, 18th, 19th.
Yes, we're about 3 months in.
Yes, we are. And I feel much better. The bottoms of my feet now have feeling. I can feel hot and cold. My balance is amazing.
That's wonderful.
Yeah, it is. And I can close my eyes and not topple over.
Yeah. So you like to do a lot of walking and
Yes,
things
I
like
do.
that?
I love to climb mountains and that sort of thing.
And that's improved.
Yes, it has. I can go into the woods, and I haven't done a mountain yet, but I can go into the woods and not fall over and not trip.
That's great. So the overall sensation has improved.
Yes, yes, it has.
And how long would you say it took till you started to feel that improvement?
I would say about a month.
Okay.
I noticed a big improvement, and the first thing to come was the balance. I could balance my, much better.
Excellent.
Yeah.
So like if you close your eyes, would you say it's improved?
Yes. Oh, dramatically. Yes.
Awesome.
Yes.
Okay. And I know that you looked around a little bit prior to coming here. Is there anything that made you want to come to our office to get care?
Yes. The fact that you had me come twice a week for an in-office or in-office session
In person,
in
yeah.
which they worked on my legs and you worked on my back. Yes, that's what made me come here.
Okay. And as far as the program itself, I mean, I know it took some time to come in and you had some homework to do, but would you say it's hard for what you had to put into it to get the results?
No, not at all hard. No, it was just consistent. That's the key, consistency.
Right, and that's the toughest thing. I have patients come in, their medical doctor says there's nothing that can be done. You can only take medication to mask it. And the reality is nerves take time to heal. They can take 12 to 18 months to heal. But here we are in 3 months.
Yeah.
And you're doing much better.
Doing much better. And I'm just not even a year out of back surgery. I had very serious back surgery. So, it's not even a year. So I'm hoping for some more improvement, really.
Yeah, so we're not done with you yet, but
No.
it sounds like you did really good. For anybody that's watching the video, do you have any recommendations or suggestions for them if they're dealing with neuropathy?
Yeah, consistency. Stay with the program. Don't give up. Do all your homework. Your vitamins. Those vitamins are important. Yeah. That's my word to them.
Great.
Consistency.
Consistency. That's great. And you were very consistent, and
very.
you get out what you put into it. So
yes.
So if you're watching the video, if you're struggling with neuropathy, if you just want to talk, you have questions, it's something I've specialized in with many years. I've helped a lot of patients, and Genevieve's a prime example of somebody we've helped out. And so if you're watching this and you want some help, feel free to reach out, and I'd love to connect.